Good afternoon. I'm Brent Roussin, Manitoba Chief Provincial Public Health Officer. Today we're announcing 3 new cases of COVID-19 in Manitoba. This brings our total to 224. As of this morning, 11 individuals are hospitalized. Of that, 5 are in intensive care. We are listing 76 individuals as recovered and making 145 active cases. The total number of deaths remains at 3. Public health investigations are continuing, and as more details are available, our website will be updated. I'd like to ask media to refer to our official case numbers to inform their reporting to the public, even if certain cases may be heard of prior to our reporting. Certainly this is important news, but there's a lot of validation that goes into our numbers before the release, so we'd ask that our official numbers be utilized. On Wednesday, 551 tests were completed at Chatham Provincial Lab, bringing the total completed tests to 15,259. These last few days have seen relatively low new cases being reported. I do not want Manitobans to interpret this that our risk is now lowered. This is too early to make these determinations, and we need to keep our guards up. We need to continue with our efforts. Our efforts are likely showing some benefits here, but now is not the time to lift them. We need to continue these efforts. We need to double our efforts to continue to keep this curve flat in Manitoba. We are increasing our testing recommendations. First responders, such as police officers, firefighters, who are showing symptoms are now also going to be prioritized for testing, starting today. Current testing parameters include people with symptoms of respiratory illness who have traveled outside of Manitoba in the last 14 days, close contacts of a confirmed case, healthcare workers, all patients admitted to hospital with respiratory symptom, lab workers who may have handled COVID samples with symptoms, individuals who live or work in the north or remote isolated communities or any congregate settings. Public health orders have been in effect, and yesterday public health inspectors in Brandon issued an emergency health hazard order yesterday to a tattoo business in Brandon on 12th Street that was continuing to operate despite the public health orders. This was the first health order issued. No fine has been assessed at this time. While the majority of businesses contracted by public health have complied with the order and have done their part to limit the spread of this virus in the province, we know that there are some businesses, some Manitobans that have not got the message about how important this is. And so this is an example of that these orders are in place and they will be enforced. We need to get the message out to all Manitobans that everyone needs to do their part to limit the transmission of this virus. And if we need to issue orders, if we need to issue fines, then that will take place if that's what we need to do to get the message across. We need to continue to take these steps to make a difference in our cases going forward. We cannot let our guard down at this time. Certainly these last few days showed relatively low numbers in Manitoba, but you don't have to look far in our neighboring jurisdictions to see case counts climbing. We've seen deaths related with COVID-19 in Canada. And so we need to keep our guards up. We need to double our efforts in order to maintain the flat curve right now in Manitoba. This is an important time upcoming for Manitobans. We have a long weekend. We have holiday celebrations, Easter and Passover. In addition to that, we've seen some relatively low case numbers in the last few days. I want to make it very clear to Manitobans that we cannot now get together for family dinners. Now is not that time. We need to adhere to physical distancing strategies, and the strong message is stay home. Staying home does not mean going to your cottage. Staying home does not mean going to faith-based organizations. Staying home does not mean taking the entire family out. Staying home is staying home. Avoid leaving your house only for essential activities, doing so alone if you can, but adhering to strict physical distancing strategies the entire time, washing your hands at all times. All travelers returning to Manitoba are required to self-isolate and monitor for symptoms 14 days after they return. International travelers are required to do so under the Federal Quarantine Act with strict penalties for contravention. This also reiterates the importance of canceling or postponing all non-essential travel. Now is not the time to travel. Now is the time to stay home. We know that these orders and all of our strategies in place have been challenging to Manitobans. But we also know that many Manitobans have been doing their part. And we can see from hints of these numbers that these efforts, these difficult efforts, are paying dividends to us. And if we loosen up now, we can start seeing the climb of our numbers, start seeing the climb of severe outcomes. So now is a time we need to double those efforts, keep these numbers down, and we'll keep moving forward as Manitobans. This virus is in all health regions of Manitoba. We cannot assume it's not not affecting the place where you live. All Manitobans need to take these precautions. Do not look to see if there is a case reported in and around you. Right now, all Manitobans need to stay home, practice physical distancing at all times. You cannot assume this virus is someplace else. It's everywhere in Manitoba right now, and we all need to do our part to limit the transmission. Like I mentioned, this weekend I feel is critical, as are the next couple weeks. We may be seeing nicer weather. We know there's holiday traditions, Easter, Passover, and we've had the combination of some low numbers being reported in the last few days. This time is critical for Manitobans. Do not attend family gatherings for Easter celebrations. Stay home, stay connected. Need to stay connected with the people we love and certainly vulnerable people. Do so virtually, but do not host a family gathering this weekend. At these family gatherings, we know the virus can be transmitted. We know it can be transmitted by people showing very, very mild symptoms. Sometimes symptoms that are so mild they're undetected. Do not host a family gathering. Stay home, protect yourselves, protect your loved ones, and protect all Manitobans, including our frontline healthcare workers. You know, during these difficult times, people are still experiencing other health problems. COVID-19 is not the only health issue right now. I want to encourage Manitobans that if you need care, medical care, do seek it. Our hospitals are safe. Our healthcare workers are experienced and dedicated, and certainly it is safe to attend for medical care if you require it. Call HealthLinks if you're not sure, but do not be afraid to attend medical care if you require it. Stay in contact with your healthcare provider. A lot of it can be done virtually right now, but under the advice of your healthcare provider, if you need to be seen, you can be seen. Please do not avoid being seen for urgent or emergent medical conditions. Call HealthLinks. If it's emergency, call 911. Our healthcare system is safe for people to use. You know, on a related note, our healthcare workers are at the front lines, keeping Manitobans safe. But we still see issues with fear and stigma. So there's examples of people presenting to medical care who aren't forthcoming about their recent travel or even their symptoms or even that their contacts to known cases. So be assured you're not going to be denied care in these circumstances. It's just that our healthcare workers need to be able to protect you and themselves. So please be forthcoming with your travel history. Please be forthcoming with your symptoms. And please be forthcoming if you are a contact to a case. Our healthcare workers need to know this. You're not going to be denied care, but you're just going to be offered the proper care. So I want to continue to advise Manitobans to seek out credible information. These are concerning times, but fear, stigma is not going to help, right? Credible information and our actions are going to help, and in fact, they may be helping if we look at these numbers, but we can't let up at this time. So visit manitoba.ca COVID/19 for up-to-date information. There's an online screening tool for COVID-19 there as well. So I think that as we look at various models, and Manitoba is currently working on our modeling and hope to have some information we can share for Manitobans in the upcoming weeks. We look at our case counts. It's showing that we are not helpless against this virus, but it does take action, and it takes a lot of action. A lot of Manitobans have stepped up. These are challenging times. But these are the type of things we need to have in place if we want to limit the impact of this virus in Manitoba. So thank you all for your help and support with this. Thank you to our healthcare workers who are on the front lines. And I'll turn it over to Lanette now.
Thank you. Good afternoon. So we've been talking a lot in the recent days about the challenges that we, just like all other jurisdictions right now, are facing with regards to PPE due to a variety of issues, including border closures and distribution disruptions. We have mentioned previously that we are now working with over 600 vendors to secure the inventory that we require to keep our staff and patients safe. And we have developed guidelines for the safe, extended use of PPE in appropriate settings and circumstances. These guidelines are being implemented across all regions and healthcare settings, with areas implementing them as they are able. We will continue to support the regions and healthcare facilities in these efforts while recognizing ongoing challenges with supply may require that we extend the timeline for implementation in some areas beyond next week. We continue to work with supply chain partners and government to identify options to enhance our supply and are in ongoing discussions with infection prevention and control as well as occupational health experts around our ability to conserve our resources where safe alternatives may exist. We are also working with health regions to identify service changes that may be implemented safely. We are very, very encouraged by the efforts of local construction, automotive, and other companies who have been answering our calls and donating much needed supplies that they agree with us that those supplies are better in the hands of healthcare providers at this time. So we continue to ask all Manitoba businesses to consider what they might be able to donate in keeping our healthcare professionals safe. And we are similarly encouraged by the efforts of local manufacturers and companies who are innovating and retooling to make us certain medical supplies closer to home. Today, we are so pleased to share the news of Canada Goose's plans to ramp up domestic production of PPE for frontline healthcare workers across the province. This includes making 100,000 reusable medical gowns at cost for healthcare workers here in Manitoba. This is fantastic news, and we thank Canada Goose for this partnership. Okay, and just we'll go back to providing some stats for you because I haven't given those for a while. So in the past week, HealthLinks has received 13,434 calls. The daily wait times varied from a low of 12 minutes on Tuesday to a high of 28 minutes last Saturday. Our online assessment tool has seen more than 405,000 web views since it launched more than 3 weeks ago, including approximately 45,000 views in the past 7 days. DynaCare continues to support us in making calls to those patients who had a negative COVID test. And in the past week, they made 5,250 calls. There are some challenges that they've been having in connecting with some people. So if you are waiting for a result from DynaCare or a negative result, and you haven't heard for a couple of days, you can call the provider who took the sample in the first place, and they should be able to help you find your results. But for the most part, the majority of people are contacted through DynaCare. And I would also just remind those who test positive will get an expedited call from public health to walk you through what the next steps are in terms of managing any symptoms and isolation. I also wanted to make note of some scheduling changes that are occurring at several of the testing sites over the long weekend. So locations in Brandon, Dauphin, Pine Falls, and Ericsdale will be closed on Good Friday. The Mount Carmel Clinic in Winnipeg will be closed Friday and Sunday. And Winnipeg's 3 other locations will operate as regularly scheduled throughout the long weekend, including the assessment clinic at St. James Centennial Pool. Sites in Thompson, Flin Flon, and the Pas will be open daily throughout the weekend with hours from 1 till 5. And finally, locations in Selkirk, Portage La Prairie, Steinbach, and Winkler will be open as normally scheduled throughout the weekend. So to see the hours and operations of the addresses of these clinics and sites, please go to manitoba.ca/COVID-19. Also an update, the COVID-19 Case Contact Center is now up and running. The center is providing additional support for public health investigators who are doing the contact tracing. Much of this work involves doing daily follow-up calls with contacts of positive patients to see if they have developed any symptoms or are having any challenges with self-isolating. And this frees up the public health officials to spend more time on investigations, which will, as the numbers increase, become more challenging to keep on top of, but with this additional support, that will be very helpful. The center did a soft launch yesterday and focused on helping contact tracing in the Prairie Mountain Health Region. And as of today, they've expanded to the rest of the province. As Dr. Roussin noted, we are reminding Manitobans to seek medical attention when it is required. This also includes the Sexual Assault Nurse Examiner Team, which we call SANE, which is located at HSC Winnipeg. Sadly, we know that the number of domestic and sexual violence is not eliminated during a pandemic, and we want Manitobans to know that help remains available to them. The SANE team is comprised of forensic nurses who will see victims of sexual and domestic violence within the past 10 days, or who have experienced it within the past 10 days. This 24/7 program sees all genders and all ages of individuals living in Winnipeg, as well as individuals 17 years or younger throughout the province. To prevent the spread of COVID-19, appropriate precautions are in place right now to protect both the patients and the staff working within the SANE team. And this includes screening patients when they arrive and having staff wear personal protective equipment. Individuals can also call ahead before arriving to reduce their wait for assessment. So they can call 204-787-2071 and ask for the same nurse, and that phone line's open 24/7 if you need it. And my last thing is I wanted to thank the postal workers who showed up to support healthcare workers by doing laps around HSC Winnipeg yesterday in their vehicles and honking their horns. And we've seen support like this in a variety of communities from different groups and organizations, and it is appreciated every single time. It provides healthcare workers with a reminder that they are not alone as they face this challenge. So thank you very much to the postal workers who organized and participated in the parade yesterday. Your support means a lot to all of us. So with that, we can open the lines to questions.
Thank you. A reminder to our reporters online, you'll have a primary question and one follow-up question. From CTV News, Michelle.
Hi, it's Michelle Gouin with CTV News. I'm wondering why you're adding first responders to the testing requirements.
Yeah, so this is just part of the our planned expansion criteria over time. So we're trying to always test those that are likely most at risk of contact. And so certainly the initial testing, those returning from travel, those who are contacts of cases, those admitted to hospital. Now we can, we're able to expand it as a number of returning travelers are diminishing. So expand it next to first responders. Again, the importance of testing in there where the potential of being exposed, but more importantly, the wanting to prioritize testing done to be able to get people back to work if they were ill.
Okay, thanks. And as a follow-up, why wasn't a fine handed out to the taxi parlor in Brandon?
Yeah, the fine wasn't handed out because they weren't in place at the time that order was issued. So the emergency health hazard order was issued, and violation of that order has very stringent penalties under the Public Health Act should it be violated.
From the Canadian Press, Steve.
Oh, hi, Dr. Roussin. I wanted to clear up something. Now that the province has announced plans to institute fines, does your public health order cover private family dinners, for example? If I have 15 people over for dinner, am I in violation of that order, and am I at risk of facing the newly announced fines?
Well, so the orders would strictly be related to public spaces. So the order itself is probably not in play in that situation. But again, it's what I've been saying from the beginning is we can't police everything. That no Manitoban should wait to see if an order applies to them. In situations where you're having large family gatherings, you're putting all those people that you care about at risk. You're putting other Manitobans at risk. You're putting our healthcare workers at risk. So there may or may not be a fine that can be handed out in every circumstance, but it really shouldn't matter to Manitobans. That behavior is risky. And so I know it's a long weekend. I know it's Easter, Passover, and people are quite used to having dinners like that, and sometimes very big dinners. This year, that's not going to happen. This year, people need to stay home.
And one quick follow-up. The number of active cases has dropped again very slightly today, and I know you were cautioned that this is just a snapshot in time, it's short-term. But what do you take from the fact that, again, today we've seen a slight drop in the number of active cases?
So, I mean, it's certainly things that we want to see. You know, certainly we're happy to see that. But it's way too early in the trajectory of our outbreak to make anything of this. So if anyone was to interpret this that the risk is lower now is definitely wrong. Our risk right now is high. These numbers are likely to continue to climb over time. And so we need to really make sure that we don't let our guards down. And like I said, this weekend is concerning to me, the timing of it, because this weekend, these next couple of weeks are critical in our battle against this virus. So we cannot have large family gatherings happening. We need to recognize that our efforts, may well have been contributing to some of these numbers, but we got to keep it up. We can't let our guards down right now.
From City News, Stephanie.
Hi there, Stephanie Lasuk with City News. Just wondering if we yet have an idea of when the cases might peak in Manitoba.
Yeah, it's a difficult question. We're working on some of our modeling studies right now, and so we hope to be able to share something with Manitobans about that. And so that peak all depends on what we do. So if we keep up our actions and continue to see some benefits from our actions, that peak actually sometimes counterintuitively is going to be stretched out. The further down the line that peak happens, the better it is for Manitobans because we are having severe cases at a much lower rate. We're not overwhelming our healthcare system. So really difficult to predict, but hope to be able to show some pictures of what that might look at like when we get our modeling all completed.
Okay, and then just a quick follow-up from Ms. Siragusa. The guidelines you mentioned for safe and extended use of PPE, what do those guidelines actually look like?
Well, it takes each healthcare worker through different settings. So if you're working in acute care or if you're working in home care, and outlines what the minimum basic requirements are based on universal PPE. So really, when we started seeing infections among healthcare workers, we upped our strategy so that we were screening when they came in and we provided protection as they worked all day. So it's related to that, and it's also there was a lot of consultation review with other provinces, BC, Ontario, to look at what were their standards, so that we're quite aligned in that and making sure that our staff are safe throughout this whole process.
From the Winnipeg Free Press, Larry.
Dr. Roussin, Larry Cush of the Winnipeg Free Press. What is the main factor limiting more widespread testing in Manitoba? Is it money? Is it lab and staff capacity? Are there philosophical reasons? What is the number one limiting factor?
Well, the number one limiting factor sometimes fluctuates. So for quite some time it was the reagent. And that certainly is a factor now. Sometimes other supplies like viral transport media or the swabs can be an issue. So I think we're testing the right people right now. We can see that even though our numbers are down, the positive test proportion is also dropping. And so what's driving these low numbers does not appear to be testing volume. But we're expanding over time, but we have to be careful when we expand. If we open it up to anyone with respiratory symptoms, we risk overrunning the lab and then missing, testing very, very low risk people and missing the people who are at the highest risk. So we're testing the highest risk people right now, and then as we work down, we're testing lower and lower risk people to expand it. And so that's why we've moved from our current criteria now to a lower risk criteria, which is now the first responders. And we'll see how test volumes go, and then we can continue to open it up as necessary.
My follow-up is along the same lines, except I'm looking at, you've had patients or staff test positive in at least 4 nursing homes in the city in the past few weeks. Excuse me, there was also an outbreak in one unit at Health Sciences. I'm wondering, in terms of some of these institutions where you've had positive tests, could you use some of that lab capacity to do tests of staff and patients in these select institutions with asymptomatic staff to help ward off a larger outbreak?
Yeah, so the testing of asymptomatic individuals is really something that's recommended against. In testing asymptomatic individuals often can be negative, even when people are about to show signs and symptoms. And so we're going to focus on symptomatic individuals. We have, as we improve our PPE guidelines in institutions, we're going to see less and less of the risk of transmitting this, even with people who are showing very mild symptoms, which a lot of times this is what we've seen in the healthcare institutions. So we do full contact investigations. Those who require isolation for 14 days will do so. But we're going to focus our testing on those with symptoms, even very mild symptoms, but people with symptoms.
From Global, Marnie.
Good afternoon, Marnie Blunt from Global News. When it comes to expanding testing to emergency workers, we have seen with Winnipeg Police the number of officers that have had to self-isolate. Would we look at introducing similar screening measures that we've seen for nurses at hospitals where they have to have their temperature taken and go through a series of questions when arriving to work? Would we look at doing something like that for police, fire, and EMS?
Well, we could always look at that. We could, if that was something that they were interested in, we could certainly engage in the dialogue with that. Certainly people within a healthcare institution, the nature of the work allows us to screen the symptoms more frequently. It allows the easier use of universal continuous personal protective equipment. And so in those situations, it's a little bit different in those other occupations. So we'll always be looking at different factors like that, but it's not really totally analogous.
And my other question was, Prime Minister Justin Trudeau said this morning that we need to be vigilant for about a year and a half, and things won't be back to normal until we get a vaccine. What do you make of that statement, and do you agree with it?
Yeah, I mean, I think we don't know a lot about this virus, but the indications are that we're not going to deal with just a single wave and then the virus will disappear. So it's likely going to be around, and we'll have to have some measures in place to certainly monitor for it. But what is critical is this first wave, is what's going on right now. And so we need to ensure we flatten this curve, that we don't overwhelm our healthcare systems right now. As we get through this wave, we're going to know more about the virus. There may be even pharmaceutical interventions over time. And then certainly a vaccine at some time. So it's critical right now to respond to this wave to ensure we don't overwhelm the healthcare system. But it is likely that we'll have to deal with this virus in some shape or form for the foreseeable future.
From the Brandon Sun, Drew.
Thank you. This is Drew Mason, the Brandon Sun. Dr. Roussin, can you shed any more light on this business in Brandon that was shut down? And also, how did the province hear that it was still operating?
Yeah, so I don't have a whole bunch of details on the actual operation. What with these type of orders, like I mentioned, in public health, most of our time is just to work for compliance. So I'm sure that this business had been contacted, informed of the requirements, informed of what they're required to do to comply with the order, and likely repeated failures to do so resulted in this order.
Mm-hmm. And just to follow up for Ms. Siragusa, but in terms of personal protective equipment, since there's community transmission happening in Winnipeg, are hospitals there being prioritized over hospitals in other parts of the province, or is it all equal?
It's all equal, but I would say some areas are at higher risk. Obviously, we know long-term care, the population is older and at risk, so they would be a high priority. Not just in Winnipeg, though, we would take a provincial approach to that, as well as obviously in the acute centers, especially on COVID units, we would want to make sure that they have everything they need. But anytime where you're dealing with blood and bodily fluids, those obviously are the ones that we need to make sure they have adequate PPE supplies. And there's other areas too where it's not such close contact or confined quarters where they're still important, but we have to look at how we can get all the supply out to everybody as soon as possible.
From CJOB, Diana.
Good afternoon, Diana from CJOB. Just a question on kind of the testing numbers and the backlog. I know the positive cases are being notified first, but is there any sort of prioritization with negative results, like our healthcare workers and other first responders getting notified before other people? And kind of what is the backlog on those results right now?
Yeah, I don't think the backlog is very big now. Dynacare has been making, when they first started, 1,200 calls a day. And they also expanded their hours, so they're now working into the weekend to make sure they keep up with the lab. So I don't think the backlog is the problem. I think there are a percentage of people they have been struggling to contact. And so I don't know if those people have changed their phone numbers or they're at work or out somewhere, but if you are one of those people who are expecting a negative result and you haven't heard from Dynacare and it's been a couple of days, then you should call the site where you had the test done or your primary care provider.
And then as a follow-up, you mentioned the COVID case contact center is up and running. How many people are staff getting in touch with on a daily basis, and what kind of capacity does the center have for the work they're doing?
That's a good question. So they're located at Deer Lodge, and there were some Red River community students who came in to help with the surveillance part. And there's also, I believe, 15 medical residents who are working to support if there's any clinical issues that need to be dealt with. And so they're working together at Deer Lodge. They have physical space where they are separated, physically distanced, and they have capacity to grow as this continues over the weeks and months.
From the Winnipeg Sun, James.
Good afternoon, James from the Winnipeg Sun. Just a quick question. Is our testing strategy evolving based on success and failure in other parts of the world or in other Canadian jurisdictions?
The testing strategy is certainly based on where the highest risk individuals are. So we want to ensure that we're using our capacity to test those that are highest risk. So it's informed. It's informed at the national level, and that's also informed from other jurisdictions. So that is where we tend to move. So certainly we'll implement testing strategies that are necessary for any unique circumstances here. But for the most part, it's nationally informed. We're looking to test those that are highest risk, and then as our capacity improves, we'll move it down to lower and lower risk individuals.
Thank you.
From CBC Radio Canada, Ezra.
Hi, Ezra Cuisneau from Radio Canada. Please, would it be possible for you to clarify the exact process to declare a previously infected person as ill, please?
Oh, how we describe someone as recovered, is that the question?
Exactly. From the time he's sick, from the time he's ill, what is the different steps to the point that, okay, now he's completely out of the blue? Right.
So our definition would be 14 days after the onset of symptoms and symptom-free. and so whichever is the longest of that. So usually by 14 days, people are symptom-free, we would include them as recovered. If after 14 days they still have symptoms, then we would wait for them to be symptom-free for 24 hours and then cover them and then call them recovered.
Thank you. So I understand that there's no other test to confirm that they're not they're still they're ill. And also, I just wanted to see, is it the same process in different provinces in Canada? Is it the same process all over our country?
That's correct. Yep. So we're not going to rely on tests. The problem with the PCR test, the molecular test that we run, is that it just detects the genetic material of the virus. It doesn't mean it's a viable virus, that it's infectious. So sometimes that test can be positive for weeks after a person is better. So that's not useful. So studies show with viral culture, which does show that, is that usually even after 7 to 8 days of after onset of symptoms, it's very unlikely they'll be still transmitting that virus. So we in Canada, we put in that safety time. So some provinces use 10 days. We use 14 days for extra safety, but we don't require a test of cure to label somebody as recovered.
From 1029 CHTM, Navi.
Good afternoon, Navi Ball with CHTM. I just wanted to ask about the proposed facilities, temporary facilities in Thompson, Winnipeg, and Brandon. I was wondering if, specifically for the Thompson facility, if it will be open just to those who are admitted into Thompson General Hospital, or will it also be open to patients in the surrounding community as well, if needed?
So, Navi, are you referring to the RFP that the Premier had mentioned a couple of days ago?
Yes.
Yeah. So my understanding is that is an alternative setting to the hospital. And so it would be for patients who are not requiring acute hospital admission, but for whatever reason, maybe it's too risky for them to go home because of the virus or because of the home setting, or they need some prolonged care, like alternative levels of care. So I believe the RFP went out looking for spaces first. So they're trying to identify where are there large spaces where we can use in the future, and then and outfit it with the beds and whatever supplies we need. So at this point, those details aren't determined, and actually my goal would be is that we're preparing for it. But if we can manage within the hospital settings, that would be ideal. So that it's kind of a backup plan that we want to have available to us if we need it.
And just wanted to get clarification on the weekend hours for the test site. So will it be Friday to Monday 1 to 5, or will it just be on Saturday and Sunday 1 to 5, and Friday and Monday are still 9 to 4?
The information that I have is Thompson, Flin Flon, the PA will be open daily throughout the weekend with hours from 1 till 5.
From CBC Manitoba, Bart.
Bart McKee, the CBC. Last week you said that this Sergeant Center would be open to deal with disadvantaged people. What's the plan for homeless people right now who are symptomatic, and why is that Sergeant Center not up and running if it is not?
This is 777. Yeah, yeah. I think that that's in the works. I don't know if there is any. I don't believe there's any utilization of it right now. But I think we'll have to follow up. I know that there's a lot of planning that's gone into it, and I think it's was moving forward. So I'll have to clarify whether it's if it's up and ready right now or not.
Okay, thanks. Ms. Siragusa, you mentioned that some protective equipment is not getting to all aspects of the healthcare system. What are, can you be clear, do you mean geographic areas? Do you mean personal care homes? Which areas of the healthcare system are not getting their protective equipment right now?
Well, ideally, we would get it out to everybody as soon as possible, and that's still our goal. But as we deal with these challenges in getting our distribution to us, it will affect what we can distribute out, obviously. So it kind of depends. So Canada Goose is now making gowns for us. So yesterday I identified that as a problem. So that will help as soon as those are ready, and I understand we're going to get them as they come off the line. We have also had some good news about gloves. Minister Friesen advocated very strongly on our behalf of all Manitobans, so we'll be getting a shipment of gloves from the federal government. So as soon as possible, we're going to get everything everyone needs out. We're going to get some things. And remember, we have been ongoing shipping supplies out. So some areas may already have a week or two supplies where they're fine. And so it's really a dynamic. I can't give you specific dates, Bartley, because it's literally changing all the time. And we will get as soon as possible to all groups.
We have time for a few more questions. Anyone have a follow to their follow?
Dr. Roussin, Dr. Keith is here. When someone's on intensive care, does that automatically mean they're in a ventilator? And has anyone survived or recovered from a ventilator or ICU?
Right, so not necessarily. So you can be in the ICU without being on a ventilator. We have 5 that are currently admitted and 4 are currently on a ventilator. I don't believe we have anyone that's listed as recovered that had spent time in the ICU, but there has been a recent step down from the ICU to the ward.
Thank you.
Diana from 680 CJOB. I guess I wasn't super clear on my question, but Ms. Siragusa, how many people are the folks at the contact center with, in communication with tracing those contacts? How many people are they reaching out to? Do you know?
Oh, I see what you're asking about. How many patients are they in contact with? Or contacts and positives. Do you know that answer?
No,
That's a public health.
Yeah, so we're looking at trying to get a detailed assessment done of, say, depending on all the reports we have in of maybe the first 150 cases, and we can try to elaborate on just how many contacts that typically will allude to. So I don't have a list of how many contacts we have right now, because that certainly changes depending on the cases, and new contacts are identified over time. So we are going to try to have a bit more of a detailed assessment that we can share with everyone.
Okay, is there any kind of ballpark? Obviously, I understand it is very, very changing very often.
So typically our contacts, and it has a wide range. If we look in other jurisdictions, and most of ours, they have a range of 2 to 20 contacts per person. So it's a big range, and it really depends on the individual and the circumstances. So I don't have the exact total that we have here.
Okay, thank you.
Dr. Roussin, Larry.
Go ahead, Larry.
Larry Kush at the Winnipeg Free Press. Dr. Roussin, do you have any breakdowns on the type or age or of patient that winds up in hospital yet? Can you make any generalizations? Are they all with underlying health conditions, or are they a specific age group?
Yeah, so I know that we are trying to work on that to get things for you that are a pretty detailed assessment of our hospital-based clients. I don't think I have those exact numbers with me here. There's some we have some breakdowns, but we're trying to work on being able to articulate that in to you to list that age breakdown, the percentage of hospital or the underlying medical conditions, hospital stays, those type of things. But I don't have that in front of me.
That's something you expect to have in the next few days or next week?
Yeah, I'd like to have something that we could provide within the week or so.
Thank you.
Stephanie Elford with City News. Just wondering if you can clarify, just so that we're on the same page. Not all frontline health workers right now will get PPE or are not expected to get PPE as the supply dwindles, or are currently not getting it, and like which areas are they working in?
So yesterday I identified that in some areas, specific areas, we were short, that we had maybe a week or two supply left. So that has changed since yesterday because we have had gowns come in and gloves come in. So they will continue to be delivered to those who are delivering direct patient care, but they will go out as they are available, and we need to look at a strategy going forward because this supply issue will continue to be on top of us throughout this whole pandemic, and you can see it everywhere. People are making or not making or delivering, or it's delivered but it's not arriving. So it's an ongoing challenge. So as soon as we have equipment available, we will be delivering it to the regions. We'll be working with the regions, and we will make sure that those who are at the most risk are receiving their supplies.
So then the universal principle that I think we discussed last week is no longer in effect, that all healthcare workers will be getting it no matter what.
No, that's not true. The universal PPE is part of a way to conserve, actually, because in the absence of any direction, people are using everything. So this provides clear direction as to what you need when. Not everybody needs a gown all the time. Not everybody needs to change in between. If you're working on a COVID unit, you just put your PPE on and you're good. You just change gloves, but you can maybe wear your mask and your glove or your gown throughout the shift. So no, it's quite detailed depending on where you work, what the PPE guidelines are, and it would be our goal that be in effect as soon as possible.
We have time for one more question.
Ms. Siragusa, Bartley Canvaser at CBC. How many of Winnipeg's 150 public health nurses are working full-time on COVID-19?
I'll ask the public health expert.
Yeah, I don't think I know the proportion of that exactly. I'm sure there's other issues that still need to be dealt with, but certainly COVID-19 is the priority right now. But I don't have an exact breakdown of how many are working just on that.
And that concludes today's media briefing. Thank you.
Thank you.